This is Kyle Miskell, and joining me today is Kat Pankratz. How are you, Dr. Pankratz?
I'm doing pretty well. How are you?
Good. So we're talking today because you were recently recognized with an award for your resident research project.
Yeah, I received the 2017 Journal of Feline Medicine and Surgery Best Resident Paper Award.
That's awesome. Congrats.
Thank you.
Tell us a little about it.
So what my resident project is we recognized that cats that were normally trapped in live traps for trap, neuter, and return for surgical castration would undergo some fear responses. So these cats that had been unowned or wandering out in the environment would then be trapped into a live trap and then transported to a new facility where they'd encounter people or other animals or other cats that they'd not been associated with before. And despite trying to decrease their fear by covering the cages, many of these cats still showed signs of fear. So what we proposed is to see if a medication that we have seen to decrease anxiety in other species like humans and rats might help to attenuate their fear responses in this setting. Anecdotally, the medication gabapentin has been used to decrease fear in our client-owned cats that veterinarians have used prior to veterinary examinations. So we wanted to test and see if it was true in this population of cats as well. And Dr. Kelly Ferris, my co-author, really inspired this research because she has over 2 years of experience and over 200 cats that she's given gabapentin to in this setting. So my research project was to use 2 different doses of gabapentin at 50 milligrams and 100 milligrams per cat compared to a placebo control to see if it would attenuate fear. And so how that would go is we'd have a cat that's in a live trap, and unlike our client cats where we can actually put our hands on them, these cats don't necessarily tolerate handling.
Right.
So being in this confined setting, we could use another metal comb to kind of insert into the cage trap to temporarily confine them to one side of the cage, and then drawing up the medication into a syringe attached to a catheter. In this case was a tomcat catheter. We could then guide the tip of the tomcat catheter into the mouth of the feral cat or the community cat to give the administration of the oral medication. And so in the study we found that we saw a significant decrease of anxiety about 2 hours after the cats received the medication, and it was definitely sustained until 3 hours. Regardless of either of the doses that they received. So as minimal as 50 milligrams of gabapentin was enough to decrease their fear responses.
Wow. That's very interesting.
Yeah.
You know, it's funny, I think my cat has been giving that.
Yeah, I bet.
So thank you.
I would say Dr. Ferris as well.
Well, my cat thanks her. Yeah. Well, that's really interesting. So this was part of your residency project?
Yes. So as a third-year clinical behavioral medicine resident in the College of the American College of Veterinary Behavior, it's a requirement that we complete a residency project and have that published as a part of my residency program.
That's fantastic. Sounds like it was pretty successful.
Yeah, I'm really happy with the kind of the publicity that it's gotten.
Yeah.
And so this research, because of that, is now available for free for the next year on the Journal of Feline Medicine and Surgery website.
Congratulations.
Thank you.
So is your residency wrapping down, or it's?
Yeah, so I'll be officially completing my residency July of this year, but I may be staying on as a fellowship for the following year here in the behavior service.
That's great. Well, we're happy to have you.
Thank you. I appreciate it.
Good job with everything, and best of luck.
Thank you.